Thank you, Mr. Speaker. And the Prime Minister referenced the priority for the first phase. And as he said, the top two priority groups are residents in care homes for older adults and their carers, all those 80 years of age and over, and frontline health and social care workers. Now, I'm not criticising that list in the slightest, but it's obvious that that's more than 400,000 people, and the Prime Minister will understand how anxious people in those particular groups are after having sacrificed so much. So can the Prime Minister tell us the answer to the question that they're going to be asking this morning, which is, when does he expect that all people in those two top groups can expect to be vaccinated?
Prime Minister.
Mr. Speaker, I think at this stage it is very, very important that people do not get their hopes up too soon about the speed with which we will be able to roll out this vaccine. It is beginning, as my right honourable friend the Health Secretary has said, from next week. We are expecting several million doses of the Pfizer-BioNTech vaccine before the end of the year. We will then be rolling it out as fast as we possibly can. But that's why I put so much emphasis, Mr. Speaker, on the continuing importance of the tiering system of mass community testing at the same time as we go forward through these tough winter months, because we will need, at the same time as we roll out the vaccine, and he's right to ask about timetables, but as we roll out the vaccine over the next few weeks, Mr. Speaker, we will need to keep that tough tiering and testing regimes in place.
Gustav.
Thank you, Mr. Speaker. Can I press the Prime Minister a bit further about the plan for care homes? And I do so because we all want this to work, because that top category is residents in care homes. And that'll obviously be a huge concern for many people. This morning, the Welsh Government has already raised some serious practical problems about the delivery of vaccines into care homes. That's bearing in mind the temperatures at which the vaccines have to be stored. Now, the Prime Minister must know this is going to be a four-nation problem, must be aware that this problem would arise. And obviously we all want to overcome this problem, and it's in that spirit that I asked the Prime Minister, what plans has he put in place to address these particular problems of getting the vaccine safely and quickly into care homes, given the practical difficulties of doing so and the anxiety that those in care homes will have about getting it quickly?
Prime Minister.
Well, he is entirely right to raise the issue of care homes and the our ability to distribute this particular type of vaccine rapidly into care homes, because it does need to be kept at minus 70 degrees, as I think the House understands. So there are logistical challenges to be overcome to get vulnerable people the access to the vaccine that they need. We are working on it with all the devolved administrations in order to ensure that the NHS across the country is able, and it's the NHS that will be in the lead, is able to distribute it as fast and as sensibly as possible to the most vulnerable groups. But he's right to raise that particular logistical difficulty. That's why it's also important that we get the AstraZeneca vaccine, which we hope will also come on stream. And while he's paying tribute to those who have been involved in the vaccines, perhaps he could also pay tribute to the work of the Vaccine Task Force, which secured the deal with Pfizer and which he, I think, criticised only a few weeks ago.